Hello everyone, today I'm here with a new video. This is a very important topic to cover with you all. It is headaches. So headache, what is headache? So the very first thing is, headache is any kind of pain around your head. It's a very simple term, headache. Okay, so I'm going to tell you about the types of headache. So we start with the tension headache. And please tell me and relate what kind of headaches do you have, and you can put it down in the comments there. So tension headache is some kind of tightness around your head or your jaw muscles or your neck muscles, here on the back or here or on the forehead. So your ears are paining, you have all tightness all over. It is kind of a tight band all over your head. Plus a poor posture with the tight muscles on the back and the upper back can also cause a referred pain to your back, to the back of your neck and to your head. So the neck headache is a pain which is referred pain from the neck. It is kind of a cervicogenic pain, and it is usually because of the underlying issue in the neck. It could be some kind of spasm on the upper shoulders, or it could be the compression of your nerves in the cervical region. It is because of the structures which are involved. It could be the upper back, which is known as the cervical region, or it could be the occipital part of the which is the attachment of the head in the cervical region. And it is because of the muscles which are involved. It could be because of the cervical spine and the ligaments, or it could be. It is also the involvement of nerve roots and the joints which lie in this area, and this is kind of a referred pain to the head. So it could be a cervicogenic pain which you're thinking only as a headache, but a referred pain from the neck. Now I'm going to talk about cluster headache. Cluster headache, the name identifies, and it says it's kind of a cluster, and it is kind of a pain on almost one side of your head, and the pain is in the eye or around your behind the eye, so this area could be involved all over, and you always think that there's just one part which is paining. It could be your ear as well sometime, and this kind of pain is like the worst one, and it usually happens during the night, and the patient is waking up from the deep sleep. There's a very common headache also called as migraine, and many patients come over with this kind of pain, and they always say that we have one side of pain, and it's kind of a throbbing and pulsing pain on one side of your head. And this is the most irritating pain, I would say, and they usually say that they're feeling nauseatic and vomiting and giddiness. Usually have sensitivity to both light and sound. If there is a lot of sound, they have headache, and if they're exposed to a lot of sunlight, usually they have headaches. So this is kind of a migraine headache, which can be referred to as. It is also associated with blurred vision sometimes. There are some kind of auditory disturbances. The patient is not able to speak up very properly, and this also gives some kind of pins and needles on your face or your head area. It also gives some kind of auditory disturbances as well. The patient is not able to hear properly and feels that everything is like disturbed, and the patient is not very comfortable with the position they are taking. They want to lie down, and sometimes they want to get up. Pain is always aggravated with any kind of exposure to stress or some kind of tension, and sometimes they say that this is hormonal as well, and it can also be associated with some kind of foods that you eat. Associated with insomnia and the sleep disturbances, which usually happen, and it is happening these days as well. And some kind of medications may also affect this kind of headache. You can just follow up my next video so that you can get to know about the how to release these kind of headaches, and I'm going to give you very, very excellent tips so that there is an immediate effect of headaches. So keep following, and just look at the points, and stay safe, stay happy. Thank you.